the next speaker,
Thank
Dr. Saurav Haral here.
Thank you, sir.
Okay.
Yes. Good evening, everyone. I'm going to present my paper on last dish stand Netarsudil critical role for advanced glaucoma patient during COVID-19. My co-author were Dr. V.S. Gupta, sir. Glaucoma is the most important cause of irreversible vision loss globally. Conventionally, the initial standard care for the primary open angle glaucoma is medical, with surgical option generally being reserved for the instances where there is a documented structural or functional progress, despite of the adequate IOP control, or there is an inability to control the IOP on medical management. Conventionally, treatment protocol dictating the use of anti-glaucoma medication till maximally tolerated medical therapy before surgical intervention does not apply to the advanced glaucoma stages. However, with the advent of the COVID-19 pandemic, elective surgeries and procedures were halted and indefinitely deferred. In such scenario, there was no option but to resort to alternative strategies, including modified fixed drug combination within the tenets of previously existing maximally tolerated medical therapy. Availability of eye drop Netarsudil in India was a new arena to opportunity that could harness for lowering IOP via the new pathway. Our study attempted to elicit the use of Netarsudil in patients of advanced glaucoma on maximally tolerated medical therapy who could not be offered the option of surgery due to global pandemic lockdown. Our objective was role of eye drop Netarsudil in the patient with advanced glaucoma on maximum tolerated medical therapy who could not be offered surgery due to global pandemic lockdown. The inclusion criteria of patient with POAG having a CDR of 0.9 or a near total cupping on a maximum tolerated medical therapy for at least 4 weeks and yet could not achieve their target IOP. The target IOP was in the early teens, like 12 mmFG, and on follow-up we did the IOP, perimetry, the BCVA, and the OCT RNFL, and these changes were observed. We found that in 2 weeks, 28 patients achieved the target IOP. Notably, the target was consistently maintained during the 6-month follow-up. Only 2 patients required the medication adjustment to reach the target. Like the pre-treatment IOP was around 18, which was on the 5-drug therapy, and after starting the Netarsudil at the 2-week, we had achieved the target IOP. Target IOP attained in 2 weeks and was maintained throughout the 6 months period. The disc changes, there were no further disc changes were seen in the field. There was no defined progression in 30 patients. However, mean deviation was found to increase. OCT RNFL also didn't show any statistically significant progression, and conjunctival hyperemia was seen in 4 patients, and it was mild to moderate. So concluding that eye drop Netarsudil provides a better IOP control and has a high safety profile even as an add-on to already existing inadequate maximally tolerated medical therapy. Thank you.
Thank you, Saurav. Sir, can we have any questions for him from the judges?
Sure.
Yeah, sorry, please ask. Go ahead with the questions.
So it was post-COVID area which made you to
Due to the COVID
test this drug?
Yes, sir. No, sir. It was in the second wave. During the second wave, we did the study actually. During the second wave of the COVID. Until that, we had got the drug in Delhi.
So would you level a pre-testing IOP pressure 18 or something like that as an abnormal pressure?
The patients we selected were of advanced glaucoma, so we generally try to keep the pressures in lower teens. So 18 was an inadequate control for those patients.
Then how can you set target pressure the same for each and every patient? Because target pressure is an individual sort of phenomena. You cannot say that this was a target pressure for all the 28 patients.
Yes, sir.
So why did you go for that? What made you to go for that? What are the criteria?
We actually were trying to do is keep it in the lower teens, but for the study purpose, we needed to have a particular point where we should have. We were trying to keep it in a lower teens only, but for the study purpose, we had calculated is at 12. It can't be generalized for all 28 patients. It should have been individual.
And did you check all the parameters?
Yeah, we checked the optic disc changes, the field changes, and the OCT RNFL. Yes, sir.
Okay. So, what is your carry-home message?
This was just an alternative that we tried during the COVID pandemic, and where we couldn't offer. And today also there are few patients where you can't you give a surgical option, so we can have a last ditch option to add another therapy to the regular point.
You have any proposal for going for some long-term studies?
Yes, sir, but right now we would rather prefer a surgical intervention in advanced glaucoma cases. So those were the desperate times where we needed the desperate measures. So long-term study in such case would won't be.
Thank you.
Thank you, sir.
Hello.
Thank you,
Did you
doctor.
notice any changes in the cornea?
Okay, just one question.
Any cornea? Did you notice any changes?
Sir, we didn't observe it at that time. At that time, we didn't knew about it. It has an effect on cornea. So